내게 달려와 내일은 더 빛나지 당연 yeah. 내 삶은 shine like a diamond.
Hey YouTube community, question. Are you thinking about getting plastic surgery? You know, maybe a tummy tuck or a BBL or some breast work? And if you answer yes, my next question is, are you prepared to live with a scar for the rest of your life? And if you answered yes to both of those questions, then stay tuned and let's talk about scar development after plastic surgery and what you can do to embrace and refine your scars. If you're new to this channel, my name is Aisha and welcome to the Bracorriah X Beauty YouTube channel, where we are a cosmetic company that provides quality cosmetic products, give information on starting and running a business, and we also here to provide good old-fashioned empowerment to anybody who's in need. And if you're one of our returning viewers, I do have to take a moment and thank you for watching, liking, sharing, and subscribing to our last few videos. Your support is truly appreciated, and please keep tuning in each and every Friday for a new video. Now, back to these scars. When you get plastic surgery, please know that scars are inevitable with most procedures, especially those major procedures like a tummy tuck or a breast lift or a breast augmentation or a breast reduction. There are a lot of people who shy away from surgery because of the scars. And you got some of those people who can care less about them scars. They just want the surgery. Well, regardless of which category you fall into, it is important to educate yourself on every aspect of getting plastic surgery. And that includes scar development and management. Now, some of y'all out there saying, sis, what in the heck makes you qualified to even be discussing this topic? Well, first off, scars are not developed solely from plastic surgery. That's the focus of this video, but we got people such as myself who also have scars from a variety of other reasons, such as injury, C-sections, skin conditions like acne and psoriasis, burns, and so much more. And I'm also speaking of my clinical experience. As I told you guys in a previous video, I've been in healthcare since 1999. And I've been a nurse for well over 13 years. And I've worked in a variety of settings. But with that being said, I do have to put my disclaimer out there. I am not attempting to give you guys medical advice. This video is for informational purposes only, and I am merely giving my opinion and perspective. And as we do our patients, we always advise you to seek medical guidance from your primary care provider. And that will just ensure that any recommendations or orders that you receive, they're given on the basis of you and your individualized medical history. So, let's start out with the basics of how scars develop and what we consider the norm. Normal skin is composed of an abundance of collagen, and that collagen in normal skin is usually arranged in a basket weave formation. Collagen is the most abundant protein in the body that can be found in your muscles, your bones, your skin. And its main purpose is to provide structure and basically hold or mend those structures together. So when you have a break in your skin, your body sends blood flow and fibroblasts to the point of that skin breakdown. And that fibroblast is really what in turn is what produces collagen. That collagen that is sent as a result of skin breakdown, it is usually aligned in a single direction, and that is the ultimate mechanism of how scarring develops. And again, going back, if you can recall earlier in the video, we indicated that in normal skin, collagen is usually arranged in a basket weave formation. So that brings me to my next question. What does a normal tummy tuck scar look like? Or any scar for that matter? And that's a very valid question, because how do you know that your scar is abnormal if you don't really understand what the norm is and what your scar really should look like? Well, initially after surgery, depending on what procedure you've had and your provider's preference, you sometimes may not have the ability to see your incision because some providers choose to cover your scar with tape. And they usually will ask that you leave that in place for an extended period of time. And in these situations, you really don't have anything to compare by. Going back to what a normal incision should look like. Maybe about 3 months or so after your procedure, if you press on your incision, it should minimize the redness and the darker discoloration around that incision line, and you should actually see a clean, smooth, flat, pencil-thin line underneath all the redness and the other discoloration. That is what a normal incision should look like. And yes, as long as you find a great provider, there are techniques that they utilize during surgery to help ensure that you come out with a clean incision line and a clean scar development after your procedure. So that the outer discoloration, redness, darkness that we see, that is what can be refined and what we typically use creams and strips to manipulate. The incision, however, is indefinite. Please do not be fooled by all these folks who say that they can remove your scar with creams and whatever else. And if somebody come trying to sell you some creams or a strip and they saying that it can remove your scar, please look them dead in the face and say, hey, I am not Willie Foo-Foo and I was not born yesterday. Now give me 50 feet. Or y'all can hit them with that back in the gap. Y'all remember when we used to say, talk to the hand because the face don't understand. Yeah, y'all remember that talk to the hand? We all went through that talk to the hand phase. So again, scars are indefinite. Please know that creams and all that other stuff, they can improve the appearance, but they do not remove the incision. Now that we understand, or you understand, how scars develop and what the norm is, let's talk about some measures that you can utilize to ensure that you're satisfied with your scar. And I'm going to focus in a little bit more on tummy tuck scars because that's probably one of the biggest procedure that we see in which scars develop. And it also is one of the more frequently performed surgeries that leave the biggest and most noticeable scar. Now, the first thing I would recommend is make sure you speak with your physician during the consultation about your scar. And make sure that you give your expectations of what you'd like to see in both the surgery and your scar appearance. Now, most times the V-shaped curved incisions are better aesthetically, and they can also be hidden better behind a swimsuit or panties. In comparison, those incisions that are a bit more straight across are more difficult to hide just due to your body's anatomy and how your body is typically covered when you're wearing undies or a swimsuit. You also want to have realistic expectations. Please know that the amount of fat and skin that you have to have removed will determine your scar appearance. The procedure you get will also determine the length of the incision. That's just like people who get a mini tummy tuck. Well, a mini tummy tuck will usually leave a scar that's smaller than a full tummy tuck. And a extended tummy tuck usually will leave a scar that's larger than the scar that you see when you get a full or a mini tummy tuck. The other thing that you want to keep in mind when you're discussing your incision with your provider, lower incisions are better because they're easier to hide. And we typically tell people when you're headed to your consultation, wear some, some panties or wear a swimsuit that you frequently wear, and because it just allows you to help the provider visually understand how low you want your scar, just on the basis of the underwear and the swimsuit you typically wear. Some people get conscious about their scars and, they don't want to do this, that, and the third because of their scar. Please don't even worry about that. Your scar is technically gonna sit like near your vagina or your private parts. And technically those areas are usually covered up. Unless you one of those hot girls or those hot boys that be, showing all what you done got. So, besides, no, but if somebody get that far to where they can see your tummy tuck scar, where it's near your goods, trust me, they can care less how your monkey look and what it's got on it. They on a mission, so they can care less. Just remember, a good plastic surgeon or provider, they should offer to have that discussion with you during that consultation. They should intentionally ask, what are your expectations when it comes to scarring? And that's regardless of the procedure you have, breast work and all. Now let's talk about some of the things you have available to you to improve the appearance of your scars. Well, one of the least invasive measures you can use is scar creams. There are an abundance of scar creams that you can use to improve the appearance of your scar. And I'm not going to go too far into the scar creams because I am planning on doing another video on the best creams to use and what ingredients they should have. So again, I'm going to minimize the scar cream discussion, but just know that there's a variety of them out there. Some are a little cheaper. Some are a bit more expensive. And just remember, wherever your budget falls, you get what you pay for. Some of those cheaper ones, you probably can tell they were a little bit cheaper. And I personally feel like you get a little bit more bang and satisfaction for your buck if you put a little bit more money behind your scar management. So, the other thing that you want to make sure that you incorporate into your scar regimen is silicone. Silicone is a really good ingredient that is used either via topical creams or strips. You also have some gels that, come with silicone in them. And there are several clinical studies out there that have clinically proven the efficacy of silicone. And it ultimately just helps with reducing that tension and minimizing or fading the redness and the discolorations that you see around your scar. It also helps to flatten those scars. So silicone is really good to have within your scar regimen after you've had plastic surgery. And just remember, irregardless of whichever intervention you use, they all have pros and cons. Now, moving along, you also want to ensure that you are staying away from sunlight and UV rays. You're avoiding that sun exposure. UV rays will affect the appearance of your scars and definitely can make them look very irritated. So I know you just got a new stomach. I know you just hit the flat side, but please don't be sitting out with your scar exposed. Cover it up until it is healed a bit more. And know that UV rays can move through your clothes. So just as you got a bikini on, you covered up, still always use sunscreen when you're going to be outside for an extended period of time. And we usually recommend that people use at least an SPF of 30 when, in their sunscreen. Now, a few other more costly interventions that you can consider would be scar revision surgery. And when you're considering scar revision surgery, it is really important to know that it does not remove the scar. It just makes it less noticeable. And if you already have keloid or raised scars and skin, if you're prone to developing keloids, know that there is a risk of more scarring just as a result of getting that procedure. So that's something you definitely need to consider. You also have some people who get steroid injections, and this usually just helps to flatten and soften that scar. You also have microdermabrasion and dermabrasion. And in those techniques, they're ultimately just removing the skin's top layer, which will again refine the appearance of that scar. Now, hear me when I say, scar care and refinement goes well beyond just that aftercare. There are some things that you can and should be doing prior to even going to surgery that will help you recover better from that surgery, but also help with scar care and how your scar actually heals. And just know, the first thing I want to key in on is genetics. Genetics play about 50, and some people may argue 75% of what your scars look like when you are post-surgery. Genetics do make a difference. That Dana, it makes a difference in how your scars end up. The other thing to consider is at least 1 to 2 weeks before your procedure, you want to make sure that you have a good diet. Stay away from those oils and those sodiums and those processed foods, because those foods will increase your chances of inflammation and swelling in your body. And swelling and inflammation plays a part in how your incision heals and ultimately how that scar will result. The other thing you want to consider is exercise. Please make sure that you are exercising prior to surgery because of the extreme deconditioning that you will experience after like a tummy tuck and some of those other procedures. You want to make sure that you're in the best shape of your life. Well, maybe not the best shape of your life, but you want to make sure you're in good shape. Your body is more apt to recover if you are in better shape. So exercise and procedures like a tummy tuck. If you look at the pain that you're in and how you're stooped over for so long and the decreased mobility that you experience with a tummy tuck, please make sure that you start an exercise regimen before. As I said, it will help you recover quicker and just help you sustain during the time of your decreased mobility. The other thing you want to consider, stay away from alcohol. Yes, I know. I loves me a good old cocktail myself. But stay away from alcohol. It thins the blood and you don't want to be dealing with any kind of bleeding issues. Another thing that you want to do before is you want to make sure that you stop smoking. You are already prone to respiratory issues such as pneumonia just due to the lack of activity. And smoking just further complicates things. And it increases the restriction to further expand your lung capacity. And this definitely can interfere with your ability to take deep breaths. Please do not smoke. It definitely will interfere with your recovery. The other thing you want to do is you want to take a multiple vitamin. You know, some providers will recommend a week, some 5 days, some 2 weeks before surgery. But this will help ensure that you're not going into surgery with a deficiency, which can delay healing. Your body cannot effectively recover from such strenuous manipulations if you're going in with a pre-existing deficiency. Now, the most noticeable deficiency we often see is obviously iron deficiency due to anemia, but definitely make sure that you get yourself a good multiple vitamin. You also want to make sure that that multiple vitamin, or you get in some way some probiotics on board. That is a great source for gut control. And considering all the meds that you'll be taking, you definitely want to get yourself a probiotic. We also see that some providers will actually prescribe an antibiotic postoperatively. And this just increases your chances of stomach and digestive instability. I mean, the other clinicians out there can tell you, antibiotics and those things are often the antecedent to digestive and GI upsets like C. diff. Getting yourself a probiotics will help stabilize all of that. You also have providers who will recommend an anti-inflammatory, such as the arnicas and the bromelins before surgery. These are great anti-inflammatories, and they definitely will help with the pain, the swelling, and the bruising. So definitely get yourself some bromelain and some arnica. Bromelain is definitely a enzymatic derivative from pineapples. So those are just a few things that, I wanted to mention. There are some things that you definitely should consider taking and researching and looking into when you're getting surgery. They'll help when it comes to making sure you develop those scars that you're satisfied with and you're content with. If you're getting ready to have surgery, these are some excellent things that you need to consider incorporating into your regimen. If you are still at that point where you haven't necessarily made the decision to get surgery and you're still kind of doing some research and determining what you'll need, definitely consider those things and keep researching what you'll need. Now, if you got through this whole video, I'm going to need you to remember, behind every scar, there is an untold story of survival. Now I want you to comment down below and let me know what you have survived. And I already know you survived this video. So don't tell me you survived my shenanigans, because I already know. Thank you for watching, YouTube. Be easy, be beautiful, be blessed, and be you.